All right, whenever you're ready.
All right. College is a time for experimenting, right? We party, we don't get enough sleep, and sometimes we even go a step further and start experimenting with drugs. But what people don't fail to realize is when you begin experimenting with drugs, you can just keep, having a downward spiral, and you can begin even using needles. This can lead to lifelong infections such as hepatitis B and C and HIV. According to the Center for Disease and Control and Prevention, more than 1.1 million people are living with HIV in the United States right now. Many of us have known or maybe even have experienced something like this. Legalizing needle exchange programs in the United States is a good step, and it's always better than just locking someone up who's doing drugs or trying just to take the drugs away. After much research and even a personal battle with something similar to this, I know how helpful these can be. Today I want to persuade you that needle exchange programs are crucial to reducing the spread of HIV in the United States. First, I want to discuss the HIV epidemic in the United States and what makes it so dangerous. And then second, I want to discuss the benefits of legalizing needle exchange programs in order to help fight HIV. First, I want to talk about the pandemic here, or the epidemic in the United States and why it's so dangerous. First, there are multiple ways to contract HIV. Most known way is having sex with the same sex. The number affected this way is growing. According to the Center for Disease Control, there was a 12% increase in the number of infections between gay and bisexual males from 2008 to 2010. It's important to realize that HIV is affecting our generation most. According to the Center for Disease Control, the youngest group that they surveyed, which was ages 13 through 24, has the highest number of HIV infections. So it's not our professors or our parents, but it's us. This is a map that shows the estimated AIDS cases throughout the United States. And obviously in the South, it's more dense, but there still are thousands of cases up north. Another way to contract HIV is through needles and injecting substances in the body. According to the Center for Disease Control, 16% of women who contracted HIV did so through the use of a needle. In 2010, 10% of HIV victims were injection drug users. Since HIV began in the United States, 182,000 people have died who were drug users. But we can do something to prevent the spread of HIV. One way is through legalizing needle exchange programs. Obviously, we can't completely eliminate drug use in America, but we can do things to reduce the spread of HIV. Needle exchange programs are a great way to provide clean needles, according to the Center for Disease Control. When someone comes in who's wanting a clean needle, they have to first give them their dirty needle in exchange for a sterile syringe. Centers like this also provide free beneficial services, such as alcohol pads, condoms, and referrals to substance abuse programs. In 7 government-funded reports, researchers unanimously agree that these things can help reduce the spread of HIV throughout the United States, and they didn't find any data supporting that it encouraged drug use. But not all states have legalized needle exchange programs. There's 200 program centers in the United States, but they're only in 36 states. 14 states still fail to realize that without clean needles, HIV, hepatitis B, and hepatitis C are just going to continue to be on the rise throughout the years. According to doctors from the College of Physicians, the demand for clean syringes is at $1 billion and rising. It does take funding to keep centers like this open, but it's far less than the lifetime cost of fighting HIV, which is $120,000 per person. That means that if 5% of injection users contract HIV, over $2 billion is going to be needed to treat them over a lifetime. To conclude with you today, I've shared with you facts and statistics about HIV and the benefits to legalizing needle exchange programs in order to help fight HIV. With the target group of those being affected by HIV being us, it's important to realize the severity of HIV and how we can reduce the risk, like through needle exchange programs. These programs contribute greatly to the fight against HIV by providing sterile syringes and self-help to those who are wanting it. We all know it's impossible to completely eliminate drugs, but with legalization of needle exchange programs, lives can be saved and help can be given. Thanks.